um, oh, I just got a message that this is being recorded. So it's okay. So anyways, we reached out to the local food banks, and they were in desperate need of support. So what we did was we leveraged our food bank license that we have on campus to support the Cornell community, and we started to mobilize a pop-up food pantry for the entire community. We took one of our dining facilities that is currently offline, and we set up stations, kind of like you're shopping from cart to cart to build boxes. We then put the boxes together that can feed a family of 4 for 3 days, put them in refrigerated trucks, take them down to a central location. It's called an activity center in the center of Ithaca. And myself and my team have been distributing meals out to the community, and it's been very rewarding and very fulfilling. And it's been a great experience. We've done it for 3 or 4 days now, and we have served over 15,000 meals to the community. So very, very impactful. And I'll end with this because I know I only have a couple minutes here. The first day that I left the food pantry, I get a little emotional when I talk about this. I was leaving, and the people that were picking up boxes, as I was driving through the community, they were breaking the boxes open and handing food out to their other people within their community. They could not get to the food pantry. So very impactful. I'm so fortunate to work for an organization that supports our dining program to be able to execute these type of meals for the community, and they are getting nutritious meals as well. We are getting fresh produce that we're able to hand out, and as well as some obviously shelf-stable items. So been very rewarding, and I appreciate the opportunity to speak about the initiative.
Well, thank you so much, Dustin. I saw what you had posted on LinkedIn, and I was really inspired. So I'm glad you got to share that with everyone.
Yep.
Looking now for Kurt. I am never great at pronouncing your last name. Kwiatkowski from Michigan State University. You can unmute yourself. Great. Kurt, tell us what you to at Michigan State, and I wanted to use this as an excuse to give a warm welcome. Kurt is one of our newest members, along with his colleagues at Michigan State. So over to you for your 2 minutes.
Thank you. So 2 minutes, yeah, it's been a whirlwind. I was telling people in the group chat, we still have more students on campus than we really should, and kind of along the lines of what Dustin did, kind of like that feel good in all of this. With the large amount of inventory we have on campus, normally serving close to 40,000 meals a day just in our res dining, coming to a screeching halt right now, we're averaging only about 2,400 meals a day. Taking our ingredients that are perishable and coming up to date, working with, we have a food bank right on campus, and working with him and taking our catering department and our hotel that had basically come to a screeching halt as well, taking all of those employees, the chefs that were there and a couple of the cooks. And we've been taking all of the food, the produce, any meat that was thawed, and preparing meals for the community for them to hand out. And, it's, thousands of meals that we've been able to give out. And the first weekend we did it, we had just people coming as families. And this was really before social distancing was becoming a thing, but it's incredibly powerful. I'd say if there's things that are going to come out of this, I'm hopeful that understanding of how to use inventory tools and communication is crucial for our team, for as big as we are. And it's been, every day sometimes things are changing, whether it's the way things are served, how many people we're allowing in the door, to everything. So it's been interesting.
Well, thank you for that, and I think it really highlights what Eric shared at the beginning of so being accustomed to long-term timelines, planning maybe by meal cycles or quarters or semesters, then down to weeks, down to days, now minute to minute really being the new pace of change, and the way that all of you are adapting and providing food is just extraordinary. So thank you for that. And I appreciate also that you shared a kind of a lesson learned, or I think that's really what we're aiming to extract here with this insights exchange is what are you noticing that is helpful in resilience for that long term. So next up, I'm really pleased that Patty Kloss has agreed to share on behalf of Tufts. Patty, over to you in sunny Napa, Boston.
Yeah, Napa, Boston. Thank you. Our campus had the foresight, maybe yours did too. We stood up a Corona working group in January and had met maybe a half a dozen times before our index patient presented on March 10th. By the time their positive test came back, we were right at spring break. The university had made the decision, like our neighbor down the street across the river, to send our students home and to go to distance learning. So we went from delivering one meal to one student in isolation in 4 days to 43 on-campus students who went into self-quarantine in 19 different buildings. We did not have a delivery program. I'll add that there were 150 close contact off-campus students that our host communities had quite a bit of consternation over how was the university going to monitor them. And I think we all can imagine the answer to that. But on any given day, 30 meals going out using initially a Google form, spreadsheets, and a few phone calls. But we have the fortune of having military fellows as part of our Flitcher School of International Law and Diplomacy. They were activated immediately by our president and have been working collaboratively with them for SOPs. Some of the volunteers have experience with outbreaks in Africa. You can imagine some of the protocols they've gotten involved with. Going from 10,000 meals a day to less than 200 meant we set up an incident command structure in our organization and had to build in duplication or redundancy in positions that did not exist before. And the teams have collaborated well on this. It's given us actually an opportunity now to do more cross-training and development of additional resources whenever we emerge into our new normal. We began to use Zoom, learning technology overnight, holding daily briefings, about 30 minutes, very tight. We'd have 26, 27, almost all of our team on those meetings, trying to get everybody information at the same time, even though they broke off into smaller groups. We did have an order from our governor on March 15th that all restaurants had to go to delivery or takeout. And at the time, no more than 25 could be present at the same time. Now it's only 10. So we worked with our Office for Campus Life and instituted a reservation system rather than telling them when to eat, knowing that some students would stay on campus and need to go to class or be sitting in class. We allowed them, we extended our meal hours and set them up in 15-minute blocks so they could reserve what time they would come in for our takeout. And we've stuck by a decision to date, this could change by dinner time, that we wanted to continue to serve hot food, perceiving that to be a fresher, healthy orientation at the time, inspiring people to either refrigerate it right away or consume it right away. I'm proud that we're still, if anything, even more embracing of our MOC principles of the types of things that we want to offer our students, knowing that the World Health and CDC have said one of the best ways to, not the best way, but one way to deal with this is to be healthier ourselves. And so much in how we're caring for ourselves mentally, physically, the food we're putting in our bodies. Our biggest worry right now isn't when we'll come out of it, but will we have the food that we want when we come out of it? And so trying to find ways to reach out to our local farms and support them as they're trying to plant.
Right.
So.
Wow, that's extraordinary and so powerful, the proactive and collective leadership. And definitely like your point, this is aimed at also unearthing what's remaining essential for you and how do the MOC principles stay relevant? Are they relevant? And where is that all falling in the hierarchy of priorities? And there was a great op-ed authored by Dr. Dariush Mozaffarian from Tufts on exactly that topic of, actually I'll send it in the chat, very much about diet as a powerful form of keeping us all healthy during this time and into the future. So that's a good transition to our last kind of round speakers in the dining and operations insights that actually are going to transition now into research and education. And so Dr. Wendy Slusser, Associate Vice Provost of the Semel Healthy Campus Initiative at UCLA, along with her colleagues Al and Pete, will share what's happening there, both from a dining standpoint and really campus-wide.
Thanks, Sophie and Eric, for including us in this discussion. And as most of you know, the Semel HCI has been in operation for almost 10 years with the aim to infuse the culture of health into the fabric of our campus. And our VC, just like it sounds like at Tufts, our VC of administration, who's a member of our HCI steering committee, has also been holding coronavirus weekly calls since the beginning of 2020. The Healthy Campus Initiative, we're a collective group of students, staff, faculty, and leaders, and we've been working together really for these last 10 years to infuse a culture of health into every single operation. So the COVID-19 really has raised our work now where everyone actually, I think, is prioritizing health along with all of us, which is really great for, I think, everybody, that they're observing how much health is equivalent to wealth, really. So we've augmented our support for the physical, emotional, and social well-being on the campus and in the LA community through email communications called Bruin Posts. For instance, the first week that we were closed, which was the week just before finals, we distributed to over 85,000 staff, faculty, and students a post that focused on emotional and social well-being, which is an area that a lot of people hadn't been hearing much about at the time. And we got a lot of positive feedback from that. We've also launched a new podcast series called 6 Feet Apart, interviewing experts on how to address social, emotional, physical well-being in our new normal. And we just posted our second one this week, and every week we're going to be posting more, and anyone's, can share it. We're open to having you listen and give us feedback. One of our immediate areas that we addressed, though, is the basic needs of our community, that in particular was around food. And our first responders, that includes health workers and also campus essential workers like police department and the maintenance department, were the group that we wanted to be sure to get fed, because it wasn't just necessarily access, it was also availability of food for them because of their long hours. And our students in need, which are being addressed by our group that has been addressing food insecurity on our campus for the last decade. We're now giving students, since most of them are off campus now, gift cards, and also offering virtual teaching kitchen experiences so that they can learn what to do with the food that they can buy. And we're also, we were fortunate to be connected to the World Central Kitchen. And so this is helping to employ the outside restaurants. And I believe they've expanded from LA to other places like San Francisco, New York, I think New Jersey, Connecticut. So they're in many cities now. If you haven't heard about them, they've been really helpful to us. And they're kind of like a treat meal. They can't feed our entire workforce, but they can help. Mm-hmm. And then I'd like to hand it over to Pete and Al, because thanks to our strong and long-term working relationship with Al and Pete, the basic needs of our community are being addressed, not just on campus, but off campus. So I'll let them share what they have been doing.
Thank you. Pete, Al?
Hi, I'm here.
Hi, there you are.
The basic needs I'm trying to focus on with my team right now is really keeping our business solvent and protecting jobs. We've seen a dramatic drop off in our business volumes. We're not, we receive no state funding. Everything is through student housing fees and dining fees. And we're writing off about $100 million of revenue over a 6-month period. We're trying to keep staff productive by rotating shifts so that they keep at a minimum medical coverage as long as possible. The last thing we want to do is see our team members at some point down the road not have medical coverage with the COVID virus to deal with. And we're focusing work, our business volumes are not here. We typically do 35,000 meals a day. We're down to barely 1,700 student meals a day, right? We're focusing our efforts to assist the health enterprise here at UCLA. They're at the forefront of dealing with the impacts from this virus. We've converted our hotel operations to be used for COVID discharged patients for recovery.
Wow.
And we're providing food and services, essential services for that group. So we're working very closely with the hospital in a variety of areas, also converting dorm inventory for use for COVID recovery and other hospital uses. So we're trying to keep staff engaged and cross-trained and able to work in those areas. We've also done food donations up at Lake Arrowhead to the local community. We've donated 15,000 N95 masks that we had in place for our team to the medical enterprise. And we're working right now through Mayor Garcetti's office to try to see how we can leverage our commissary and production capabilities to provide food for the needy in Los Angeles. And I'll conclude with my two biggest worries going forward is, what does the fall look like? If fall is written off and going to be a remote learning environment, we're going to have significant ramifications from that. And at the same time, paralleled with that is how do we protect and hold our human capital, our human expertise, so if we should be able to go back to normal business volume, we have the people in place to pick up operations where we last left off. So that's the recap I have from our
Well, thank you so much, and really appreciate your sort of bigger questions to ponder and mull. I'm sure that there, as Eric described, there's the response, the recovery, and the resilience. And I think that was a concept shared in the Menus of Change Business Leadership Council earlier. And many of us are thinking in those different phases of time. It's great also to hear from UCLA, the themes I'm hearing from a lot of other universities as well, of greater need for teaching kitchens, virtual, right? Cooking skills, culinary literacy, basic needs, absolutely. Partnerships with food banks, pantries, community food hubs, as well as partnerships with healthcare and providing beds. And it's just really wonderful to hear from each of you. So I do want to move now to implications of the coronavirus for research and education. One of the things I've been thinking a lot about is how our education exchange in some ways is more relevant than ever. We were looking at distance learning before all of us needed to be doing so. But in other ways, this is actually really undermining a lot of the work, of course, or creating new barriers and new challenges, as well as perhaps entirely new research questions. So that's what we really want to hear about for the next several minutes. And I'm going to let Research Program Manager Ghislaine Chalamel tee that up.
Thank you, Sophie. I hope you can hear me well. We had our monthly research working group call on Monday, and obviously that was a very different call than usual. We used a lot of time to share our experience in our different campuses about how all of these crises impact the research. And I would like to ask Christopher Gardner from Stanford to talk a little bit about the impact of the crisis on his research, clinical research, and also the research that he was doing in the dining hall. Christopher, you have 2 minutes.
Sure. Okay, so I do some MCURC research, but I do a lot of other things, and I call them feeder and bleeder studies. So I ask people to eat different things, and then they come in and get a blood draw to see what happens to their cholesterol or blood pressure, and all those facilities are shut down. So some of my studies are ruined unless I can get people to delay and move time points and things like that. So that's a separate area of my research. I'm also mentoring an MCURC fellow, Alessandra Marcone, who was doing a dining hall intervention, and she was all set up at multiple time points to do signage and data collection. It's an honors project. It's her senior year. There's no chance to redo this honors project. And so she now has to just use a partial data set. We all have to talk together that she went through the process, even though she doesn't have all the data that she needs, and it's the process that's valuable. So we're trying to figure out how to do that. So it's making some adjustments in how we're doing the research. I'll use the last couple of seconds to just say I had a fabulous breakout with Emily from Vanderbilt and Hema from Stanford and Tara from Oregon about how they're handling things in a takeout way that they never did before. And so being ever the researcher in my mind, I'm thinking, oh my God, the buffet is gone. This is an opportunity. This is a research opportunity. The students would bitch if you took away their buffet unless they're not there anymore. And it's takeout now. So I wonder different ways. I know that people are sort of more aspirational if they're picking what they're going to eat tomorrow. as opposed to what they're going to eat this minute when there's a brownie in front of them. So maybe ordering in advance, they're choosing more wisely. So I'd like to toss that out as a research opportunity. And I'll also close and say in my human nutrition class with everybody at home right now, the TAs and I have offered to set up a set of recipes at every class so the students can cook at home on their own, and we'll give them some suggestions. I'll stop there.
That's awesome. Thank you so much, Christopher. I think it goes directly into what Becky Ramsing from Johns Hopkins has witnessed in her campus because of the shift of all research to COVID-19 related research, right? So Becky, if you want to share.
Sure. Hi. Nice to be part and just hear what everyone is doing. I'm really impressed with the food service and how just hearing about these food service stories and just the adaptability and this opportunity you're all taking just to make things not only to respond, but to make things even better and to excel. And so that's been really encouraging. So at Hopkins, I would say that I think the bigger universities, especially the School of Public Health, is in this response phase. And so all the School of Public Health research has been halted except for COVID related. And you probably follow that we have a information page with daily podcasts and articles. So a lot of research has just been shifted right into COVID-19. Of interest, there's also they put together a Coursera course, a free Coursera course on COVID-19. So if you have anyone who's interested in just learning right now, that's available. And also some other courses they're just making available for people to take while they may have some downtime. I don't have any downtime, I don't know why. But so at our center, the Center for a Livable Future, we work really in the food system. And so we're really seeing that this crisis is affecting the food system and public health in ways that are evolving and just becoming more dramatic every day. So we're concerned about how it's affecting food security, food access, food production, workers, and other aspects of the food system, both now and in the future. So we're really looking like how can we really prepare and help with the next step with the recovery, and how can we understand what's going to be happening with the food system now that we may not see the impacts until later. So there's 6 areas I'll just cover real quick that I wrote down. One is that we work as a convener. So we work with food policy. We have a food policy network that we run, which includes over 300 food policy councils across the US and Canada. And so we've been very active with them, helping them connect and learn from each other about how they're reducing barriers to food access and supporting food producers and food workers during this time. We've had, like our first webinar, we had over 600 registrants. So it's been, and we have a big Google Doc where we're just putting a lot of resources in. People are sharing, you're just sitting in Google now because that's the quickest way to start. We are preparing a lot of research in order to understand the full impact of COVID-19 on the food system. In particular, we're doing 2 surveys. One, we're working with several other research from other universities looking at consumer food access and food security experiences and needs during this time. So it's being first fielded in Vermont, and then it'll be in the US and Maryland. We're also doing another survey looking at food system workers during COVID-19, their experiences, perceptions of the food system workers in the private sector, and also the public sector, and also the volunteers in the community food response. We're also trying to track just other food system indicators over time to generate this broad picture of what's happening in the food system with COVID-19. We have our seafood team looking at the shocks to the global seafood system, which is really interesting because most seafood is eaten in dining. Most people eat it away from home. So it's really caused a whole shift to the value chain, the seafood value chain. And we're also looking at equity and social justice effects of COVID-19 on consumer food purchasing behavior. I would say, in terms of like, you're talking about research, Christopher, we had some research doing in both our undergrad campus and our School of Public Health looking at impact of plant-forward diet communications and Meatless Monday that is going to be put on hold. But we are going to be reaching out to our food service to see, how they are adjusting. I would say 2 other things. I'm probably running out of time. We have a community of practices with 5 cities with our resilience team is working with, like trying to support engagement among cities as cities are developing pandemic responses and creating tools for food system resilience during crises such as this. It's a report, we did a report in 2017 that really laid the groundwork for this. So that's, the time is great. And then our policy team is working with just following all the different policies that are happening federally and in states that have to do with COVID and food. They're working very closely with the National Sustainable Ag Coalition, looking at how SNAP benefits are being changed, if the access is being improved, and the benefits are being expanded. And I would say finally, we are also just looking at tools, how we can help consumers through, we are science advisors at Meatless Monday. So through that kind of communication audience, we're working on trying to help them understand what's happening in the food system, but also, you know, how do you shift to, how do you deal with the shift in how you're purchasing and how you're cooking and preparing food during this time. So that is, tried to not to take too long, but that's really
certainly, yeah, that's incredible. I did share the link to the Coursera.
Okay.
I believe that's the right one. That's really remarkable that they're offering that, and amazing to hear some of the opportunities that, or the resources really that your colleagues are providing. So at this point, hopefully you're gathering what Eric said, that this is really just scratching the surface on each element of MCURC, and this is popcorn style, super fast. There's so much to dig into from all of the campuses, and we plan to hold follow-up conversations as we get now these better examples of sort of the different patterns and themes that are emerging, and dive in deeper to different areas. But we wanted to leave you all with a bright spot of the MCURC Fellows Program, some hope. A phrase that I've been stealing from a friend is stewarding positivity. And I think that the fellows help each of us to do that. So Maureen and Co, you have 3 minutes to tell us all about the fellows program in Corona pandemic.
Hi, everyone. I'll talk real quick so we can get to the people. So as Sophie said, the Fellows Program has been such a bright light. We had a meeting a couple weeks ago, and 10 different advisors on the call talking about their fellows. And Julie and I were just so energized and excited to have everybody together, and everybody just wanted to be together and talk about their program. So I don't want to talk more, but we want to hear from Sam at UC Berkeley and then Marcus from Duke with their fellows. So Sam, do you want to start?
Sure. So I am so fortunate I get to keep my student team employed during this time, and they're working on their projects remotely. Our fellows, Ale is in Mexico, and Juliet is local in the Bay Area, and they're working on doing some short videos and cooking demos and how they can encourage their new roommates, which is mostly their parents, how to eat healthy and sustainable as well. And then I took this project from talking to Alex at the University of Michigan, but I've been able to send them a list of our ingredients, and they're attaching greenhouse gas emissions to each of the ingredients. And so when we do come back to normal, our menu management system will be able to tell us what greenhouse gas ingredients are part of which recipes, and then we can develop what we're going to call low carbon menus for catering campus restaurants and our dining halls. So they're already finished with that project. I'm really excited to put that into the system and see what those menus look like. Thank you.
Oh, Maureen, you were on mute. I think you're teeing it up to.
Thanks, Sam. That was awesome. Marcus, you're next.
Yeah. So very quickly, Allie, who is the fellow that I've been working with this semester, is working from Philadelphia, and her two projects are the first thing that she's working on is developing a survey so that we can begin to better understand when students are making decisions about where they want to eat on campus. How are they prioritizing that? So is it a matter of what their class schedule is, where their friends are eating, whether or not they have religious restriction, any other kind of dietary restrictions, and then where does sustainability land in that? So we're working on kind of as sophisticated survey as we can to kind of start to zero in on how students prioritize that. The second thing that she is working on is norm setting on campus around food and sustainability. So she's looking specifically at orientation week for the first year students and looking at how can we change those events so that it's clear as soon as students get on campus that we do take food and sustainability issues very seriously, whether it's food waste or climate conscious dining or takeout waste, all those sorts of things. So she's looking at how the orientation week schedule can be adjusted to establish those norms as soon as those students arrive on campus.
Wow. Well, Well, thank you, Maureen and Marcus and Sam. I think it's so exciting that the fellows are continuing virtually. I mean, one of the things we really wanted to emphasize about the collaborative is that we've been a virtual network from the start. Now, fellows work is typically on campus, but in many ways they're joining the way that we all stay connected through technology the vast majority of the time from apart. It's also giving me this idea perhaps for Christopher and other researchers of rather than campus dining halls as living laboratories, or I should say in addition, home kitchens as living laboratories for behavior change. And I love this notion of students taking, as the vectors from campuses to their parents, their households, perhaps their neighbors via email or other safe communication forums. So all kinds of interesting, perhaps silver linings or just new questions to ponder, new scary questions too, as we've heard. It's not all, it's a mix of emotions, yes, and type of situations, but we do hope to connect with all of you in the coming weeks through further insights exchanges. This was really just the first, and we'd love to hear from you about what you want to chat most about and really how you see the MCURC right now. So we may be sharing a survey after this together to gain a better sense of that. For today, we hope it was nice just to see one another across time zones and across the country. And I am so grateful to all 72 of you who at one point were with us today. Eric, any closing comments?
That's amazing. Community, thank you so much, everyone, for participating today, for jumping on the call during a busy time. More to come also. We'll be sending a newsletter out soon, and we know we're in that response phase, but we're working towards recovery and resilience. So thank you all so much for your support of the MCURC. I hope you found it a valuable insight of this cross-pollination and collaboration between all of the different roles at so many universities. Stay safe, be well, take care of yourselves, and we'll talk to you soon. Bye.
Well, thanks everyone. Take care.
Thank you.
Thank you.